My name is Max Rutherford and I am a psychologist at the Australian Prostate Cancer Centre. People will inevitably react to that first diagnosis with a sense of shock and a sort of feeling of wanting to try and understand more what's going on. And often in medical consults, people don't hear a lot of what's said, particularly when the word cancer is used, because it's a very powerful word. Absolutely. That has all sorts of different meanings for different people. Often it's better to wait a little while until the patient has had a chance to digest the medical information first, and then they can start to think about it. But often in the first stages, the doctor needs to perform some tests, and those tests take time, and so there's a lot of anxiety between the first appointment and the second or third appointment, which comes 2 or 3 or more weeks later, where the patient has to just sit with having no idea what's going on. Doctors might even have a hunch that chances are this is a fairly low-grade cancer and that the prognosis is very good, but they're sometimes a bit reluctant to say that until they're certain of that, because there are sometimes instances when that's not true. So the first thing that's difficult to deal with is that uncertainty about what's going on, that initial shock. And so really one of the first coping strategies is to try to get more information, and you get that information from your doctors, from reading, from talking to other people who've maybe had similar kinds of conditions. And actually from a psychological perspective, the most helpful thing in those early phases is information. Or two of the most common challenges of having prostate cancer is that is some of the side effects of treatment. Most men experience some degree of incontinence, from which they'll recover further down the track, but it's very challenging in the early stages to experience that. And most men will have some degree of sexual dysfunction as a consequence of the surgery. And often patients are so focused in the early stages on managing the cancer that even though they're told they might have these side effects post-treatment, they have difficulty taking that in. There are a few things that can help. One is to allow time, and often the decisions about treatment are not that pressing for prostate cancer. So if you allow a couple of weeks or a month, it's really not going to make a big difference either way. So allow yourself time to have a think about it, and gather information. Read the materials that have been offered to you by your clinicians. Perhaps go to one of the support groups, of which there are many in Melbourne and around the country, and just get the perspective of other men who've perhaps been through a similar situation, and talk to family and friends, and just allow time. Often we go to bed one night and then we wake up the next morning and we find the decision is made, and we're not quite sure when we actually made the decision, but it's kind of come to us. There are certain questionnaires or decision aids that you can use, but in the end it's a matter of allowing time and talking to as many people as possible, and I guess accepting that often there isn't 100% right decision. We have to kind of take a punt, but people tend to do better if they've really done a lot of work beforehand, so that when they've made a decision, they know they've made an informed decision rather than just doing something impulsively. Carers, interestingly in the research, carers sometimes struggle even more than the patients themselves with the initial diagnosis. And it's hypothesized that one of the reasons for that is that they can't do anything. The patient has to be treated by the doctors, and the partner can't actually fix the situation for their partner, and so they feel a bit kind of helpless and feel as if there's not much that they can do. So it is very distressing, and of course they they care for their partners, and so they're worried about losing them and so on, and so that it is very distressing for everybody involved. I don't think there's a general rule about whether partners come or not. Both myself and my colleagues are always very happy to see the partners, and it can be very helpful for the partners to come along. But everyone has their different preferences for whether they prefer to come on their own or prefer to come with their partners. So what might work for one man won't necessarily work for another man. And of course, as a psychologist, I feel that it's often helpful to talk to someone. Typically, when people are upset, the first thing that comes to mind is that they want to go and talk to someone about what it is that's upsetting them. One of the common things that people say to me is that it's only for people who have really severe problems, and I would argue that that's not necessarily the case, and in fact you can prevent things from worsening over time by talking to someone when things are relatively mild, or when problems are relatively mild, so that you get a grip of things more quickly. And also therapy is seen as something kind of esoteric and outside the normal scheme of things. But one way you can think about it is that if you have a problem at work, for instance, then you either tend to go and talk to a colleague or arrange a meeting, and through that process of conversation, then there's a new understanding that arises, and often people find that they can find solutions that they hadn't thought about in just processing it in their own minds. So talking is really helpful, and if you have a partner or a friend or someone in particular that you feel very comfortable talking to, then that's a great way to proceed. But sometimes it's helpful to be able to talk to someone who's outside one's normal circle, because then you can talk freely about whatever is on your mind without having to worry about how other people are going to react. And so there's a kind of freedom in that. I guess in both cases, a lot of it depends on the context, on what else is happening in the person's life at the time, and that's always something that's very variable, and it's also dependent on what age the patients become diagnosed. So obviously it's challenging for anyone to be diagnosed with an advanced cancer, but to be diagnosed with such in your early 50s or early 60s is really hits people very hard, as opposed to a bit later in life. For people who've been diagnosed with more advanced cancer, it's much more pressing, because the prospect of their life being somewhat shortened is greater, or at least anxieties about that are greater, and the treatments are a little bit more, have a bit more of an impact. A certain percentage of men with low-grade prostate cancer that can quite realistically be placed on active surveillance, which means that no treatment is not being recommended at the moment, and such men are encouraged to continue with regular PSA testing, and sometimes to have yearly or 2-yearly biopsies, just to keep an eye on the cancer. But it's assumed that for the moment it's safe not to do any treatment, and it may be safe never to do any treatment, but that we should just keep an eye on things. And that in itself is challenging in a way, because on the one hand you're being told that nothing needs to be done, but on the other hand you're being told that we need to keep an eye on things. And so that can be a real trigger for anxiety. They understandably have the view that if there's any cancer in me, I want to get rid of it as quickly as possible. But what we know about prostate cancer is that most men, once they reach a certain age, will have a small amount of prostate cancer, and that in many cases this won't develop into a serious disease. And so if men can tolerate that anxiety, that sense that there is a little bit of cancer there, but it's not going to develop, then it's a very important that they're able to just sit with that. Some for them that's just too hard. But there's an analogy that I sometimes use, and that is if you have a car and you have a little bit of rust on the car, there's a question of, well, how will that develop over time? And how it develops is dependent on a wide range of factors. It depends where the rust is, how much it's spread, how often the car will get wet, what kind of condition, how often you use the car. There's such a huge number of variables, and that's one of the difficulties for patients, I think, is that patients think that their doctors know what's going on, and their doctors do know a lot about the disease, but they only know in a general sense, and it's very difficult for them to say what's going to happen to any individual patient. But I guess patients can rest assured is that if the doctor has recommended active surveillance, then they feel fairly confident that that's a safe thing for that particular patient to do. The typical treatment for advanced prostate cancer that is spread into the bloodstream away from the prostate area is something called androgen deprivation therapy, which is a treatment that suppresses the testosterone in a man's body. And there are potentially, and not always, but potentially a number of side effects associated with that, including fatigue, loss of libido, which is not only loss of sexual function but sometimes loss of desire, memory problems, hot flushes, some cognitive difficulties. Some men become a little bit depressed, some become more irritable, and then there are quite marked physiological changes that go along with that. And I guess what it demands of patients is that they work much harder to deal with those side effects. For many men, the sexual side effects of treatment are quite devastating, really. And it's certainly, once the cancer has been treated, probably one of the things that I talk about more than anything else. Something has changed in one's sense of self, and so even in a kind of non-sexual context, some men even feel uncomfortable flirting with somebody for fear of, just because they feel different. Something has been taken away from them, which is a normal part of their, or has been a very important part of their identity. And in terms of the management of that, first of all, it's important to be aware that there are strategies that men can use, such as taking medications such as Viagra. There are something called a vacuum pump, and there are also injections that can help to facilitate men having better erections, and those are important and can be very helpful to some men. But the most important thing I think is for men to recognize that the sexual act is very wide and very variable, and there's not just one way to be intimate. Willing to talk with their partners and find new ways, then it's really quite possible to have an active, intimate life. It's just a different kind of life. There are many men who maintain a very active, intimate life despite having these difficulties.